Hi, thank you so much for having me. I sincerely appreciate the opportunity to share some of the research and expand upon what Ashley has spoken about. Just as a note, Ashley and I collaborated on much of the research she spoke about, so I would be happy to answer any questions that cover the scope of her presentation as well. So I just want to start by kind of defining a little bit more about how we assess ultra-processed food addiction in the literature before I start presenting data that speaks specifically to the social justice implications of this work. So as Ashley was mentioning, the Yale Food Addiction Scale is the primary tool that we use to operationalize this clinical presentation of ultra-processed food addiction. And it assesses the 11 DSM diagnostic criteria for substance use disorders and directly applies those criteria to assess the problematic addictive-like intake of ultra-processed foods. So, as Ashley mentioned, some just examples that parallel those diagnostic criteria are continued intake despite consequences, a persistent but unsuccessful desire to cut down on these foods, and very core addiction mechanisms like withdrawal. Just as you could meet criteria for a substance use disorder, an individual meets criteria for ultra-processed food addiction if they endorse two or more symptoms of the 11, and also an indication of clinical impairment or distress. So currently, all of this is sussed out by this self-report measure, the Yale Food Addiction Scale. Importantly, two systematic reviews have recently come out that collate data across 281 studies and across 36 countries to estimate the point prevalence of ultra-processed food addiction. And when we're looking at samples from across the world and collating that, it's a prevalence of about 14% in adults, which is very similar to alcohol use disorder, which is 14%, and tobacco use disorder, which is 18%. And extremely notably, the rates of ultra-processed food addiction are 12% in children, which obviously there is no parallel to that with substance use disorders. So kind of going into some of the very significant health disparities that have been noted in one of my recent research studies conducted in a nationally representative sample of individuals in the United States with almost 1,000 participants, rates of ultra-processed food addiction by racial and ethnic identification revealed some pretty striking disparities. So the point prevalence among individuals who identified as white was about 12%, and you can see that among individuals who identified as Hispanic, it's almost a third of our participants. And this was not a clinical sample. So this is estimating based on demographically matched individuals what the point prevalence might be in different groups. So this is really striking and concerning. Other findings from that study included that individuals who reported having a lower household income and exhibiting symptoms of ultra-processed food addiction were more likely to have those addictive-like eating behaviors translate into a higher BMI and obesity. And household food insecurity was reported to increase the risk of ultra-processed food addiction by 20 to 56%. So there's some really notable trends here, and it kind of brings up the question of why? Why are we noticing this? I have two kind of key takeaways that I tend to kind of hang the hat on. One is target marketing. Big food companies very directly have targeted people of color when they're marketing ultra-processed foods. So one of the things Ashley was alluding to is that there was a minority marketing plan put into place when Philip Morris, which is the tobacco company, bought Kraft and General Foods in the 1980s. Specifically, what this entailed and continues to entail is that strategies marketing tobacco to persons of color were applied to ultra-processed food marketing, again, starting just when this company bought it up the big food industry. Some examples of this were disproportionately more marketing in media outlets and locations that are frequented by Black and Hispanic individuals, corporate-sponsored community events within these communities, associating specific brands with certain underrepresented groups. So a prominent example that's noted in the literature is Tang, which is a beverage being marketed primarily to Hispanic families and including Black and Latino and Latina celebrities in fast food campaigns. So very specific targeting marketing efforts that are not paralleled when we're looking at communities that are primarily white individuals. The second major issue is that there is this kind of systemic influence on UPF intake, or ultra-processed food intake. Importantly, these foods are cheap and they are calorie dense, which makes them an understandably common choice for people who have lower household incomes or food insecurity. I think one of the most important distinctions about this literature is that it is true that people need to eat to survive, but they don't need to eat ultra-processed foods. This is a very silly analogy when I say it this way, but it's almost like saying we need to drink to survive, but we don't have to drink alcohol. We need water to survive. We need naturally occurring foods to survive, not these industry-created foods that are very correlated with diet-related disease and other conditions. I think it's really important to note that the abundance of these foods in our supply strongly influences food choices and is really leading to addictive responses in both children and adults. This really goes beyond the narrative of willpower and personal responsibility. The rates of obesity have not increased in our society because people are less responsible for their eating choices. It's really directly on a parallel timeline as these foods infiltrating our food environment. Psychoeducation campaigns are also minimally effective. People know what they need to be eating, but are struggling to follow through with those choices. And these foods are highly reinforcing, which motivates their intake among people experiencing stress. So I just want everyone to imagine this as I'm wrapping up. If there were as many cues in our environment for alcohol as there were for ultra-processed foods, including the places we see ultra-processed foods in children's environments, I think there's just an unprecedented harm that is present and something for us to be considering. Thank you.